And that's one reason why, busy as I am, I really am keen to get some uh, lay persons mainly, but they could be for professionals, seminars, courses, workshops, whatever, in order that people will know more about herbal medicine, that they are allowed to buy, they can grow their own, they can pick them in the wild if it's legal to do so. Um, and also to tell people a lot about more naturopathic techniques for simple things. I mean, I had bursitis, an inflammation in the joint of my thumb a few weeks ago. I got rid of it in 3 days. Yeah, I mean, totally simple technique to do it. Totally simple.
Yeah.
With things I've got, well, one thing mainly that I've got in the kitchen, really easy compress to make. And in 3 days of leaving on a certain compress overnight, the bursitis had gone. The inflammation was completely gone. The pain was gone. The thumb was perfectly flexible again. I want people to know this type of thing. I want them to have a choice if they want to go.
There's an increase. I'm pleased to say that there is an influx of new people becoming aware of this sort of lifestyle choice, because I don't want to use certain words. I'm going to call it lifestyle choices, because I don't think it's a word that's flagged on certain platforms. But there's an increase of people becoming aware of these lifestyle choices, which is fantastic. But there needs to be more, of course. And in order to break down that programming, the perception of this type of lifestyle choice, it's going to need, lots of repetition. It's going to need lots of, as you say, like these courses which you're planning on doing. All crucial. Getting the word out to people is of critical importance. I was going to say something, and I've just completely forgot what it was. But yeah, it's just that there's a real misnomer about it, and that is that naturopathic medicine and stuff, it doesn't work. It's pseudoscience and all this kind of talk, and these narratives that get pushed around, probably from special interests.
Yeah, I mean, to just clarify my knowledge about this, about the way people choose, I've actually been quite busy, or very busy, since day one when I finally qualified. There have always been people who don't want to, for whatever reason, they don't want to go to the doctor. That is from like over 30 years ago. I've known people who just won't go to the doctor. So it's not a new thing.
Yeah.
It's just getting more and more people who are saying, I worked last weekend, Thursday, Friday, Saturday, Sunday in Glastonbury, and I had several patients who said, I just can't even see a doctor. I feel I need to be face-to-face, and they just want to do a phone call. Well, that might be adequate. I don't know. They know how they're working, I'm sure. But it's not what a lot of people want. And even if they go to the doctor, one doctor told me that he got 6.25 minutes on average with each patient. And if one person took 8 minutes, someone else had to suffer from his time loss. So when people come to people like me, they're with us for about 1.25 hours for the initial consultation. And I really can't do my job properly in less time. So I'm not sure how the doctors do it, but, I'm not a doctor.
Well, it's about, care. Care is about, it should mean care, but it's being used, to sort of as a marketing term. This word care.
Well, the word
because there's no care involved in their actions.
Yeah. Well, the word physician originally comes from, I think, Greek. I'm not sure. It means healer. And as my teachers kept pushing into us all the time, you need to do the physical, the metaphysical, maybe even the spiritual. If you don't address at least the first two of those, you're not going to get near to the problem. I mean, a lot of all iridologists will do iridology to the nth degree in the physical terms, but very few of us these days do metaphysical iridology, which means that we can see through people's eyes, their personality and how they respond to different stresses in life, and a lot more. And again, to back that up, every herbalist will deal with herbs at a physical level, but there are a few of us in this country who deal with herbs at a metaphysical level, which means that we can address the etheric level of people's being, if you like. Very,
Yeah.
very lovely part of healing to be able to do. Yeah.
Because there's more part.
Sorry?
Go ahead, sorry. Sorry.
I can give many examples of people who have benefited greatly from herbs used at a metaphysical level. Even animals. We don't deal with animals without the assistance or the permission of a vet. But I remember a lady, patient of mine many years ago, came and said, my dog is having a terrible time. He was trapped in a kitchen fire and we did rescue him, but he won't go near the house now and the vet doesn't know what to do. And I treated this dog metaphysically with the backing of the vet and the dog was fine. We took away the trauma in that way. Yeah, absolutely true story. And I used herbs metaphysically when I was first thinking about doing this. A lady who came and devastated. She was a patient of mine for other reasons, but her husband had been diagnosed with Alzheimer's, and she was devastated. This was the end of her life. And I gave her one metaphysical herb without telling her, and she came to see me for a follow-up consultation a month later. She was not only okay with it, she'd opened up the local branch of the Alzheimer's Association. So, you could do things to this depth on occasions. Yeah. You've got a sign behind you, never give up. Well, I've got a handful of herbs which help people to keep going. And you would put just a small amount, very small amount, into whatever herbal formula they're having from it for maybe other reasons. People could come for a skin problem and they've got the herbal medicine and we've just put maybe one drop of a metaphysical herb in. It's powerful stuff and people don't realize it.